Thank you, Mr. Speaker, and I thank the gentleman from Louisiana for his leadership on Men's Health Month. Mr. Speaker, I'm a nerd. I'm a proud nerd. And so whenever there is an awareness month, one of the first things I like to do is figure out, is there a theme? Drives my staff crazy. So there is a theme, as you have heard, for 2025 for Men's Health Month, and it is very enlightening. Closing the empathy gaps in men's health. Now, this theme aims to highlight the importance of addressing the unique challenges that face men for their health and encourage them to seek early detection and treatment. Because the leading causes of death for men in the United States are preventable: heart disease, cancer, and unintentional injuries. And while awareness and funding efforts have successfully addressed numerous health challenges over the years, men's health issues have received significantly less attention and funding, despite statistics that show a clear concern. Men die 6 years earlier than women due to preventable health issues. Prostate cancer and testicular cancer receive far less attention. And even during Breast Cancer Awareness Month, people assume that is only something that women face. And yet men also get and die of breast cancer. Suicide rates among men are significantly higher than women, yet the mental health infrastructure fails to acknowledge the interventions that resonate with men. And as you heard, the culture for many, many years has told men, you don't need mental health attention, suck it up. That's probably true for a lot of health issues. And he would not like to hear me do this, but I'm going to use my husband as an example. My husband needed to have spinal fusion surgery. I sat with him in the emergency room as the doctor started ticking through different issues or different questions, trying to determine what kind of injury or what happened to lead his spine and the discs in his spine to deteriorate. He said, "Did you ever experience any tingling?" He said, "Yes, I did. I've experienced tingling in my hand and in my fingers." And the doctor asked, "How long has that happened?" And to my shock, my husband said, 3 years. For 3 years, he felt tingling in his fingers and yet didn't think, maybe I should get that checked out. He tried to have a tooth extracted without any local anesthesia or Novocaine until the pain got so much, the doctor said, we need to knock you out. And once he came out, and you know when you first come out of anesthesia, you're a little high. And I asked him, well, why did you do that? And he said, because I'm a man. Being a man does not mean you don't take care of yourself. Being a man does not mean you don't seek help when you need it. Being a man does not mean you don't get preventative screenings for early detection of cancer or heart disease or risk factors leading to heart disease. Being a man means you love yourself enough to take care of yourself. Now, as policymakers, we have the opportunity to put policies in place that help all people to access health care and stay healthy. One of those policies has been Medicaid, and ensuring that more people have health insurance, not just as a safety net when they get sick, but so that they can get the preventative care, the screenings, the regular checkups that will identify early risk factors or worse. When the Affordable Care Act was passed, we were able to lower the number of insured through both Medicaid expansion and the healthcare exchanges. A majority of the Medicaid expansion population are men, over 50%. They're more likely, incidentally, to be white men, about 59%. That's compared to the 34% of the traditional Medicaid population that are women. And who are the folks in the Medicaid expansion population? Well, our speaker, I've seen in interviews say these are single 29-year-olds sitting at home on their parents' couch playing video games. Actually, most of them are working. But they earn, for an individual, $21,597 a year. Some of them may work for employers who intentionally schedule their hours at 29 hours rather than the 30 needed to trigger employer-covered insurance. Some of them are self-employed. Some of them are in jobs, like one of my constituents who I spoke to during a press conference after we passed the big, ugly bill, who worked as a contractor, got injured, could not work anymore, but also was trying to get workers' comp and was caught in that process. What we saw, and I was a state legislator when we expanded Medicaid in Virginia, and part of why we did it was because we recognized that just because you don't have health insurance doesn't mean you don't get sick. Not having health insurance does mean, though, you're less likely to get your preventative screenings. You're less likely to go to your primary care doctor or even have a primary care doctor. You're less likely to get your annual checkups. But what we have seen since expanding Medicaid, as I talked to healthcare providers in Virginia, is that by connecting the expansion population to a medical home, they are getting those screenings. They are getting preventative care. And as a result, fewer are showing up in the emergency room sick. Unlike the traditional Medicaid population, which has very complex medical conditions, the expansion population, typically, when you connect them to a medical home, are healthier. That's why I'm so concerned that the big ugly bill that we passed 2 weeks ago now, according to the Congressional Budget Office, which will strip 16 million Americans of health insurance, will make the issue worse of the disparities in men's health care or men's health. I'll pick on one piece of that bill that hasn't gotten a lot of attention. The bill now requires states to impose copays for the expansion population only of up to $35. Sitting in the Energy and Commerce Committee, I heard the rationale for this was everybody needs to have skin in the game. And if I pay a copay with my private insurance, then why can't the expansion population pay a copay? Here's the difference. I've done the math, and someone in the expansion population, an individual making $21,597 at most a year, that's about $17.99 a month. In Richmond, the average rent on an apartment is $1,569. The average utility bills are $197. The average grocery bills are $350. And so when you are faced with a $35 copay and you make $17.99 a month, and over 2/3, if not more, are going to rent, utilities, and grocery bills. I haven't even gotten to transportation costs to get to and from work. And that's just if you're an individual. And you're faced with a $35 copay to get your annual checkup or to get these screenings. You're going to think really carefully about, do I have that $35? And what we have seen, and this is why states haven't imposed copays to date, is you're less likely to get those preventative screenings. You're less likely to get the annual checkups. And therefore, these preventable illnesses are caught oftentimes when it's too late. And there are certain illnesses that are deadly but silent killers. And I'll close with this. My brother-in-law is one such example, Greg Beckwith. He was a basketball player. He was particularly healthy, but he came from a family that had a history of heart disease and diabetes. He did everything right. He lost weight, he watched his diet, and yet about a year ago, he woke up one morning feeling nauseous. Nausea is not usually associated with heart disease. He thought he had food poisoning. And so they waited until it got so bad they were like, you know what, something is wrong. Went to the emergency room, and he, in fact, had a heart attack. Part of what we need to do with Men's Health Awareness Month is not just identify what are the unique factors impacting men's health. What are the policies that we can put in place to help people get and stay healthy? But ensure that we are educating people on what are the warning signs of diseases that you might be at risk for. We know the agencies that do a lot of that work in the Health and Human Services Department. The CDC is a big one. And yet, the CDC is one of the agencies that have been gutted through DOGE, the workforce decimated. Health and Human Services has lost over a quarter of its workforce. Many of those cuts and the funding cuts that have already happened through DOGE, not through Congress, through DOGE, are cutting the very workforce that we need to help identify what are the risk factors unique to men and what are the ways to prevent it. And we can't make America healthy again if we're ripping health insurance away from 16 million people, if we are undermining and then gutting our public health workforce. And these are just a couple of the things that have happened. I haven't even touched on the Medicare cuts that are triggered as a result of the pay-as-you-go law. But we also, I said I was closing, but like a good Baptist preacher, I might have one or two more closes in me since we have an hour. We also have to stop legislating and policymaking in silos. This is one of my biggest frustrations as a legislator. I spent 18 years as a state legislator and now here in Congress. And too often we focus on healthcare policy, environmental policy, public safety policy, and we ignore that people don't live in silos and that our environment, clean air and clean water, impact public health. The health of our oceans, as it's also Ocean Month, Ocean Health Month, the health of our oceans impact public health. The stress of crime and gun violence and racism or anti-Semitism or hatred and division impact our mental and physical health. And we need to start thinking holistically about public health. We need to start thinking holistically about healthcare policy, not just being something that the Energy and Commerce Committee Healthcare Subcommittee looks at, but that every policy interconnects, and that we are looking at and studying and funding research on how holistically we improve health in America. Because I've heard time and time again, we don't have a healthcare system. We have a sick care system. And we need to get back to basics of making sure that we are identifying and preventing risk factors that lead to deaths that are preventable for men and for women. And with that, I yield back.